Well, our big focus on the show, Europe has seen a surge in cases of coronavirus in recent days, blamed partially on holidaying by the public, leading to a return in some of the restrictions in many of the countries. So countries like Spain, Ireland, Netherlands and France are bringing back strict travel restrictions, shutting restaurants and bars as cases have surged in the past few weeks. Well, today, our newsmaker to talk more about this, we're now joined by Devi Sridhar, Professor and Chair of the Global Public Health at the Edinburgh Medical School. Thank you so much for speaking to NDTV. Now, these reports of fresh coronavirus outbreaks have emerged there in Europe. It's causing some countries to bring back the restrictions. Tell us why this is happening.
Yeah, I think what we've seen in Europe is that most countries were successful in controlling coronavirus in February and March through harsh lockdown restrictions. In Spain, for example, kids couldn't even go outside the house. In Scotland, where I am, you had to stay within 5 miles of your house and only go out once a day for a walk, for exercise. But these countries opened up and have opened up particularly risky settings like bars, pubs, discos, nightclubs. And as well as we have summer tourist season in Europe with many people moving across borders for their holiday or for seeing family and friends in the summer months. It's kind of an annual rite of passage. And so what you've also seen is a jump in the number of cases and now restrictions being put back in place. In Spain, a look at shutting down bars in the nighttime, risky settings, as well as in Italy. And I think in England and in Scotland, they've still kept these open, but are looking ahead. In Scotland, schools have reopened, looking ahead to the next few weeks and trying to see if we can keep numbers low, even with having schools open and having everything else open too.
So is this
this is a major challenge. I think this is why public health.
Is there some kind of a COVID fatigue that's setting in? And, now we're going into a change of season as well. The cold weather is going to be setting in. So this will bring on its own set of challenges, isn't it?
This is a major challenge. I think this is why public health experts have been warning about the dangers of the coming months and of winter when people go inside. This virus likes to be indoors. It likes cold temperatures. And also fatigue sets in, that people want their pre-COVID life back and they want to move on. And I think this is why we might see a resurgence. And even when governments try to put in place restrictions, it's not clear they will be observed. I think also for the economic damage that's going to continue to happen for the coming months, because I think no country, maybe Taiwan is one of the exceptions, but most countries in the world have struggled with their economies at the same time, as well as the health issues. So you see them really being intertwined. The economic problem is a health problem. The health problem is an economic problem.
So what is your view on the whole, back to school push in the United States? They're seeing cases breaking out after physical school began again. Germany has begun schools again. In India, we're still waiting on, a decision by the government on reopening schools.
Yeah, so everyone agrees schools need to open. It's how do you do it safely and how do you keep them open? It's easy to open a school. It's hard to keep them open, as the United States have seen when they've tried to open schools. And this is because if you're community transmission, that means there's too many cases in the community. What's going to happen is you're going to keep seeing cases in schools, whether it's school children, whether it's parents of kids, or whether it's teachers. And that means the school has to shut, or a part of the school has to shut for 2 weeks while everyone goes into quarantine. So I think the real clear message is, yes, children can carry the virus. Yes, to a certain extent, they can transmit the virus. But if you want to get them back to school, you have to keep your numbers low in the community so they can go back and schools can stay open. And this is the approach Scotland has taken. Schools have been open now for a week. We expect that there will be cases in schools arising in the next couple of weeks, but that actually, if we can keep them low enough and small enough that you can keep most of schools going. If you have too many cases, most schools then have to shut. So I think that's the really complicated issue here of how do you get schools open and keep them open.
Now, if we talk about the vaccine news, with Russia launching their vaccine, announcing it and saying they're going to start inoculating people in October, it's once again raised concerns about, the politics and vaccines, also vaccine nationalism.
Exactly. What we've started to see is almost like who can get the man on the moon first. It's become who can develop a vaccine first, with Russia leaping ahead and saying they have a vaccine that they're rolling out. But actually, Russia's in the same position as several other vaccine candidates, which are entering phase 3 trials. And this is to see, actually, do they mount an immune response if someone is exposed to the virus? And are they safe in a large number of humans before we actually advise people to take the vaccine. And this is incredibly important that we do these phase 3 trials, to do the efficacy and the safety trials before we do rollout, because already we've seen vaccine hesitancy. That's a lot of people already nervous about vaccines, especially now for such a fastly developed one, that you want to have confidence in populations that it's been robustly tested. So I think right now, today China has come out saying they're going to have a vaccine ready in the next few months, that we need to put aside the headlines. It doesn't matter who develops a vaccine first. What matters is who develops a vaccine that's effective, that's safe, and that people accept and is affordable.
Right, and just getting the vaccine will also be half the challenge of it. The other half is actually to get it to all the people, also to get it to the people who need it the most.
Yes, exactly. Half the battle is developing a vaccine that's effective in a lab or, in a setting, a scientific setting. The second half is actually getting it out to enough people. There are big questions over which countries will get access first. Are we going to see that if a vaccine is developed in France, that French get it first? If it's in the States, that Americans get it first? How do you actually create a global framework of sharing that actually it goes to those who most need the vaccine first? And the second thing is, even within countries, how do you decide your criteria for allocation? Do you go for those in the highest risk occupations, health workers, care home workers, those who are elderly? Do you try to give it to, those who are, let's say, most at high risk for this, maybe those who are overweight, those who have pre-existing conditions? There are big questions over the distribution, that it's seen as fair and it's seen as equitable, and that actually there's some value system underpinning this, that it doesn't just go to who can pay the most, which unfortunately is how a lot of access to medical products goes.
And what about your view on the situation that we're having now in India? Every 48 hours we're crossing 1 lakh cases. Also, India is the third worst affected country, and now we're in this situation where coronavirus cases are moving from the cities to the smaller towns and villages. So what is your view of what's happening currently in India?
Yeah, this is a highly infectious virus, and it's not going to go anyway anytime soon or in a simple way. I think the thing that I noticed looking at India is India should be seen almost like the EU. It's every state is trying to approach this issue in a different way. There's wide variation between states, but they're all connected within one system. So in that way, it's a lot like looking at the countries within Europe, which all are trying to address this in their own way within a larger framework of European cooperation and collaboration. There's no easy way out for any government in the world. I think that's the clear message, that every country is struggling. Even New Zealand, which had no community transmission for 100 days, which has strict border checks, they've gone back into a lockdown because they've seen a handful of cases, and they want to really get a check on it. And it just says that actually, again, our health challenges are interconnected. As long as this is a problem in one part of the world, it's a problem for all parts of the world.
All right, and finally, I know this is an unfair question sometimes, but we have to ask all the experts. So when do you think we'll see the back of this? Do you think we have a better handle now on, the fact that so many vaccines are being developed? We're hopeful they will come sooner rather than later. So do you have any estimate, any timeline on when this pandemic, when this crisis will be over?
I think, we're getting... I guess I can give you best case scenarios, which is hopefully one of these vaccines works and phase 3 trials are successful. I'm quite hopeful from seeing the early results that we will have some kind of vaccine candidate, hopefully by early 2021. And that would be incredibly positive. And that could mean if allocation processes are done by next summer, we have some semblance of getting back to normal life. And that's about, I'd say, a year away. We're seeing various strains of this. So could it be that this could slowly, a strain that is less harmful to human health, perhaps more infectious, spreads around the world? That could be another hope. I say a hope, we don't know for sure. Could there be broader immunity than we think? Could more people have protection? So far, we're not seeing that. It seems like the cases are still increasing quite steeply in many places. These are the future scenarios. Or are we just going to get better testing? I think this could be a game changer. So a rapid test I've seen tests within 15 minutes, 10 minutes, a saliva test. People could just, have quickly be tested. That would be a game changer as well. We could control this much, much better. But we're not going back to our pre-COVID life anytime soon. I think any of these scenarios are going to be a whole different way of living and interacting in the world today.
All right, Professor Sridhar, thank you so much for speaking to us here at NDTV.